4 urologists who subspecialize in kidney stone management. We also refer patients to urologists, to dietitians. So it's pretty much comprehensive care, not just the urologist doing surgery and that's it. We also have a hotline for kidney stones. The doctors there 24 hours a day. And obviously, you get referrals from they're mostly URL and family doctors. So let's start with some myths, and then we'll try to bust these myths at the end. Some people say that lemon juice or lemon water partially will dissolve my kidney stones. If I just increase my water intake, that would take out the stones. No longer drink milk or getting any cheese in my diet, but I still keep forming stones. Coffee is probably, I keep making stones. Same for red meat. If I cut back on red meat, things would be back to normal. So why do we even bother treating them? Obviously, they cause a lot of pain. That's one good reason to treat. But there are all kind of other complications that can happen. One of them is a urinary tract infection. Sometimes that happens very acutely, and we have to treat patients pretty urgently. This could be life-threatening infections. Occasionally, we see loss of kidney function. There's a stone stuck in the urethra for months, years. That can lead to loss of kidney function. And I think quality of life is the most important thing. Think about it. You have like Joseph mentioned, you have a kidney stone, you have pain for a few days, then you end up in the ER, you spend the night in the ER, then they send you home. It takes you a week to get into urology. And then they schedule surgery, and then you have to wait another couple of weeks. And then you're in pain because of the stent. Just lots of days of work, a lot of pain, financial burden. Not great thing in general. So hence the impact on quality of life. And the same goes for monitoring. We don't just treat the kidney stone and that's it. For some reason we keep asking to come back with some imaging and some more tests. And the reason is that once you form stones, if you don't follow strict dietary guidelines, increase your food intake and do all the other things that we recommend, there's a good chance you'll form another stone in 5 years. So that's about 50% in 5 years without any adjustment. Monitoring is also important. These numbers refer to residual fragments that remain after surgery, but the data is pretty similar for asymptomatic stones. If you have stones in the kidney, there's a good chance it will cause some problems. So close to 50% chance of either passing a stone, which would probably involve some pain, or surgery in 5 years. Just a brief overview of the anatomy. This is the area that we're dealing with, the urinary collecting system. So the urine is formed here in the kidney, transported to the bladder via the ureter. That's where most of the stones get stuck, another tube for the ureter. Zooming in, that's what the inside of the kidney looks like. This dark yellow area, that's where stones are formed. They can hang in there for years, and then one day they decide to move into the ureter. And that's where the problems start. So how do they form? They're basically crystals, and made out of salt and proteins. And the simple answer is that once the saturation of these salts and proteins is over the saturation point, or the concentrations over the saturation point, that's where crystal starts to form. So this is another zoom in. This is the nephron, or the urine producing unit of the kidney. It's a complex system of blood vessels and tubules. Eventually the urine gets concentrated and produced in these ducts, and slowly drips into the urinary collecting system. So when the concentration of these crystals or salts is just too high, that's where you end up with stones in this area here, the gala, or stones flooding these tubes. And then eventually, these calcifications or plaques eventually erode to the surface and end up in the urinary collecting system. And this is what baby stones look like. This is actually a normal view of the inside of the kidney. This was taken during the surgery. These are small plaques which will eventually erode through the surface without adequate prevention. And may act as actual kidney stones. Dehydration is probably the most important thing when we talk about prevention. It's simply increasing the fluid intake will decrease the saturation of these crystals. There's certain conditions that may cause all kind of parameters in the urine to be off. Calcium, for example, high levels of calcium, high levels of oxalate. But there are also conditions that result in loss of stone inhibitors. So citrate, for example, is a stone inhibitor. Some people present with low citrate levels in the urine. This is interesting. Some bacteria have an enzyme called urase, and that enzyme breaks down urea, which is a common urine molecule, into ammonia. And that ammonia tends to bind other molecules, eventually form very large kidney stones, called screw-like stones. So these are infection stones. You see them occasionally. Urinary obstruction may relate to bladder stones, but overall in the urinary system, there is stasis of the urine. The urine is not draining properly. It just sits there. And eventually, all these crystals will settle to the bottom of the surface and start to form stones. What type of stone do we usually see? Calcium oxalate is number one, probably the most common type of stone. We see calcium phosphate 2, probably about 30% or so of stones. Uric acid stones are more common in diabetic patients, and these are the only type of stone that can be dissolved in medications. All the other stones either stay in the kidney, pass spontaneously, or removed with surgery. Screw-like infectious stones. Cystine stones are not very common, but they're linked to a genetic disease. Usually stones are formed at a very young age. So the most common type of clinical presentation is actually asymptomatic. If you have kidney stones, you know that the stone probably been there for years before causing any issues. It's pretty easy to understand because the stone is just hanging in there, different parts of the kidney, not causing any obstruction. The pain starts when one of the stones decides to move into the ureter. That can cause a lot of pain. One reason is the kidney being obstructed, so the urine keeps producing the kidney keeps producing urine. And all this urine is filling up the kidney, stretching the capsule. A lot of pain receptors here, this area, causing a lot of pain. The other reason that these stones cause pain is because once they get stuck in the ureter, there's a lot of spasm, a lot of irritation in the ureter. Just like any other visceral organ, if you have a bowel infection, for example, that causes a lot of vague pain, not very localized. Other presentation that we see with blood in the urine, that's because of the irritation of the inner surface of the urinary system. Occasionally we see urinary tract infections, and again, kidney failure, kidney dysfunction if there's a long-standing obstruction. So what do we do when patients first present? They usually present in the emergency department. And the first thing is to treat their pain. And probably the most important thing is to determine if this is appropriate for discharge of the trial process. And the main determinant here is the size. So as you can see, stones that are smaller than 5 millimeter has a pretty good chance of passing. spontaneously. It depends on where they look at the kind of presentation, upper dick or close to the bladder. But overall, small stones have a pretty good chance of passing spontaneously. Stones over 7 millimeter, certainly over 10 millimeters, usually don't even attempt trial of passage, you just schedule surgery. Trial of passage is done with a prescribed medication called Flomax or tamsulosin. That's a prostate medication. It just relaxes the ureter, so it's a smoother passage into the bladder. Once the stone is in the bladder, it should be able to heal without any issues. And then we have to, usually in the emergency room, we have to make a decision whether it's safe to discharge the patient home, or whether you have to intervene in order to prevent complications. Usually what we do in the emergency setting is kidney decompression, drainage of kidney. That can be done either through a stent or an nephrostomy tube. So the stent is, that's what it looks like. It's actually a small tube that's situated within the ureter, and it bypasses the stone. So it kind of pushes the stone to the side and allows for drainage of urine from the kidney down to the bladder. I don't know if you guys have a stent, but it's pretty uncomfortable. And that happens because of that little tail in the bladder. It causes a lot of irritation, makes you feel like you can pee a lot. Blood in the urine. Pain in the kidney when you urinate. Not great. The other option is the nephrostomy tube, and this is not internal. There's a tube that goes directly to the kidney, and there's another tube that goes into your bag, so you have to wear a bag for some time to drain the urine. Not great options. None of these are great options. So this is for drainage. How do we actually remove the stones? There are three main options to treat kidney stones, and we'll start with the least invasive way. That's the shockwave lithotripsy. This is actually a type of focused ultrasound energy that is delivered directly to the stone. So it's a non-invasive technique. There's a device outside, usually around the frame, that delivers the energy. And that's supposed to break the stone into smaller fragments, and hopefully the patient will pass these fragments spontaneously. Hopefully. One of the complications is that if you have too many fragments or really big fragments stuck in the ureter, you have to intervene and go in and actually remove these fragments. We usually pick patients that are smaller because the patient, the sun wave, have to travel a certain distance, and the more distance the shockwave has to travel, it gradually loses its energy. So smaller patients are more suitable for this type of treatment. Also, softer stones, hard stones don't tend to break very well. There's a size limit of around 20 millimeters for this type of treatment. This is what it looks like. This is actually a picture from a video from inside a patient's kidney during the procedure. You can see how the stones are gradually broken into smaller fragments. So you're supposed to pass these fragments eventually into urine. You can imagine if this thing is not broken down to smaller fragments, that would be a problem. And this is the actual setup in the operating room. Again, non-invasive, done under X-ray guidance. And this is the device that actually sends the shockwave. Next is the uroscopy, probably the most common type of procedure that we do. This is a minimally invasive approach. No incision, but we do have to pass the devices through the natural opening or the urethra. We typically use laser to break the stones into smaller fragments or dust. We do have a size limits, usually less than 2 centimeters or 2.5 centimeters. Most of the cases with a stent could be uncomfortable. It's an outpatient procedure. We have to go on the same day. And since we actually visualize the stone and see the fragments that are left behind, new fragments or cells. It tends to have higher success rates or higher stone-free rates when compared to shockwave lithotripsy. This is what it looks like with urology. So we start by passing the wire to the kidney. And in this case, we pass a sheath. And through that sheath, we pass an endoscope or an uroscope, and this is stone. We pass a laser fiber. And bam. That's what it looks like. Then once we have small enough fragments to pass through the sheath or the uretray, we just pass a grasping device and pull those fragments out. So with ureteroscopy, the limiting factor is the size of the urethra. We're limited by the size of fragments that we can remove through the urethra. So these fragments have to be small. This is what it actually looks like in real life. This is the laser fiber. This is a very advanced laser, so you can see the fragments are tiny. This is what we call dust. So you dust the stone to find fragments. Some stones don't dust very well. They tend to break into very into larger fragments. You don't have to extract. This is a very favorable stone for dusting. Potentially, we just pass those fragments in the urine without even noticing. And of course, if there's any residual fragments, we just remove them and pass it. So for larger and more complex stones, we use what we call the percutaneous nephrectomy or PCNS surgery. Usually the cutoff is around 2 centimeters, 2.5 centimeters. The way we do that, there's an incision involved. We don't do these big incisions anymore over the flank, just a 8-millimeter incision or a 1/3 of an inch incision over the kidney right here in the back. And through this incision, we pass a needle directly into the kidney, and then we have to make the tract a little wider so we can pass a sheath. That sheath allows us to pass a camera and break the stone into pretty big fragments. The surgery is obviously more invasive. There's an overnight stay involved, slightly higher risk of complications. You can imagine if you poke a hole in the kidney, you can bleed. So this is the main reason why we keep patients overnight after these surgeries. Although there's a trend in recent years to discharge patients same day. So this is what it looks like. This is the passage of the needle into the kidney. We usually do it under X-ray guidance. And here you can see the actual image from video from inside the kidney. You can see the needle inside of the lightning system. Then we pass a wire. And the rest of the surgery will be done from outside, so with a camera. So these are 3 surgeries. We really have to focus on prevention, but that's probably way more important. Stone removal. And a couple of things that we monitor or discuss when we see patients in the office. So one, we do the stone analysis. This may or may not give us some idea about what's going on. There's calcium oxalate, uric acid stone, there's infectious stone. And we go over your diet, lifestyle in general. You're hydrating during the day, do you have salt? You take all these weird supplements that may cause food stones. Are there any medications that we can make any adjustment to your patients to prevent stones? And the importance of regular follow-up to prevent complications, yeast inflammations, monitor existing stones. And we also order metabolic evaluation, which is our main tool in the metabolic workup is the urine collection. So this is a 24-hour urine collection. This is the actual report that we received from the lab. And the way this is done, you get 2 big jugs in the mail, and you have to fill them up and send a small sample from each day to the lab. This is not great fun. It's a little bit annoying. You come to the bathroom, you have to pee in this jug. But it gives us a lot of information about volume, stone components, and all kinds of stone material. And we'll get to that toward the end of the talk. So probably the main reason, or the main risk factor in giving us some information is the low urine volume. And it is simply the fact that larger urine volume simply dilute the stone components. And our recommendations for kidney stone formers is to try to get the urine volume over 2.5 liters a day. And that means that you have to drink over 2.5 liters. That's about 85 ounces of fluids. It doesn't have to be water, it could be any fluids. Water, coffee, juice, beer, wine. Try to stay away from dark sodas, Coke, Dr. Pepper, Pepsi. These contain phosphoric acid, which can promote kidney stone formation. But all the other fluids are just as fine. There's some issues that we face with hydration. Some patients can't drink a lot. So again, if you drink a lot of other fluids, if you don't like to drink, try to fruits, which have a lot of oil, or soup. Some patients say that they tend to forget, so you get yourself one of those standing database on your desk. A bunch of apps and reminders that you can set on your phones, or either even smart water bottles, such as this one. This will actually link to your cell phone and keep sending you reminders to drink. This costs $100. I don't know if it's worth it, but it's an idea for you. Next big thing is salt. Salt is a pretty big risk factor in kidney stone formation. And the reason is that the more salt that you eat, eventually your kidney is supposed to get rid of all the salt. It doesn't stay in your body. The kidneys excrete a lot of salt or sodium ions in the urine. Calcium stalls the salt like shadow. So eventually, with high salt intake, you end up with a lot of calcium in the urine. And once this calcium is oversaturated, it starts forming crystals. The recommended sodium intake is around 2 grams of salt, which is a teaspoon of salt a day. In reality, most Americans take in about 2 to 3 times that recommended amount. We get this a lot. I never add salt to my food, but it's not just the salt shaker. A lot of other things that contain loaded with salt, processed meats, canned food. There's a lot of salt. When you go to a restaurant, chances are there's going to be a lot of salt. I mean, it tastes good, but it is what it is. You just pay attention to what you eat. It's like chips, pickles, and things like that. Calcium, although calcium is a main component in kidney stones, usually it's not affected by diet. So you shouldn't cut back on calcium supplements or dairy products, if you don't have a kidney stone. Quite the opposite, actually. If you lower your calcium consumption, your body just senses the lack of calcium, and so lowering the hormones to release calcium to bring that calcium to a normal range. Then you end up with low bone mass, osteoporosis. So coming back on calcium is definitely not a good idea. Other things that may cause high levels of calcium in the urine is kidney leak. There are several genetic syndromes or conditions that may result in high levels of calcium in the urine. But also mega doses or large doses of vitamin D. We saw that during COVID. A lot of people were taking vitamin D in very high levels because of that Tapiero to them COVID. They ended up with kidney stones that generated a lot of business to urologists. There's some other conditions such as hyperparathyroidism. There are a few small glands that are embedded in the thyroid gland. Sometimes they can get rogue and produce a lot of excess hormone level. That may result in high levels of calcium in the urine. Also, excessive carbohydrates. If your diet is consisted of white bread and white rice, there's a good chance that there would be high levels of calcium in the urine. Unless there's a reversible cause of high levels of calcium, such as vitamin D or hyperparathyroid disorder, the treatment is pretty straightforward, which that consists of a diuretic. The class is called diuretics. Either indapamide, chlorothalidone, or hydrochlorothiazide. These are actually old hypertension medications. And the benefit of kidney stones is that they keep that calcium in the bloodstream. So less calcium ends up in the urine, more calcium in the blood. It actually helps with bone strength as well. Oxalate is another main thing because the most common type is calcium oxalate. Oxalate conditions usually have to do with diet. You consume a lot of oxalate in your diet, you may end up with high levels of oxalate in the urine. Oxalate, unlike other foods, oxalate is actually found in healthy foods, like leafy greens, and fruits and nuts, and legumes and grains. But we also, there's some other conditions that can result in high levels of oxalate in the urine. Maybe there's a vitamin C, we saw that too in COVID. All kind of short gut syndromes, there's some gut malabsorptions, such as after multiple resections of the gut or bypass surgery, gastric bypass surgery. That can result in high levels of oxalate in the bloodstream. Eventually, that oxalate finds itself in the urine. Low probiotics is interesting. Our bodies cannot digest the oxalate, so it cannot break it down. But we do have cellular bacteria in the gut that know how to break down the oxalate. And certain conditions, patients that receive multiple antibiotics, for example, or kind of gut alterations, especially may result in less beneficial bacteria. So there's actually more oxalate available for absorption from the gut into the bloodstream. There's an interesting interaction between oxalate and calcium. Obviously, they form crystals in the urine. But in the gut, if you eat a meal that has a lot of calcium, oxalate, and you add calcium to that meal, if the oxalate binds the calcium in the gut and doesn't absorb it. So it forms a bond in the gut and just stays in the gut until it gets excreted. Unbound oxalate, the free oxalate, is free to get absorbed into the bloodstream, then finds its way into the urine. So in certain conditions, we actually recommend increasing the calcium intake, especially if you have a high oxalate, a meal that is loaded with oxalate. It's beneficial to take some calcium, either in the form of supplement or drink a glass of milk. But it has to be done at the same time as the oxalate. This will just list a bunch of foods with high oxalate content. So you can see a lot of good stuff here. Healthy stuff, spinach, miso, I like miso soup, almonds, a lot of nuts, berries, roots, chocolate, a lot of good stuff. But the thing is with oxalate, you don't necessarily have to subtract oxalate from your diet. Just try to add calcium. Be aware. Try to add an inhibitor. Either drink an extra glass of water, or milk, or take a calcium supplement. Same time with the oxalate. There's some weird supplements, herbal preparations, and collagen. Some of the collagen supplements contain a lot of oxalate, so you've got to be aware. Other than dietary modifications, the other two options to treat high levels of oxalate in the urine are either the addition of vitamin B6 or calcium citrate. The vitamin B6 blocks some of the pathways of oxalate metabolism. And so occasionally we prescribe the vitamin B6 and the calcium again because it simply binds the oxalate in the gut, it doesn't go to jail. Next is the urine pH or the acidity. The kidney, other than filtering the waste and other molecules or proteins in the bloodstream, it also helps control the pH or the acidity in the blood. So the blood has a very narrow range for optimal pH. And there are a few molecules in the urine that can buffer the plasma or increase the pH. One of them is citrate, so that when the kidney senses a state of acidity, there's a high acid load in the kidney, it releases citrate to the bloodstream. That citrate is actually a stone inhibitor. So you're losing a lot of stone inhibitors because of the acidic load. Another buffer system that we have is bones. So again, every time there's a state of low pH or high acidity, the bones release phosphates into the bloodstream to buffer the acidity. And when phosphate gets released from the bones, it also is followed by calcium. So whenever there's a chronic state of acidity, you also lose some bone mass. So this is something you want to avoid. So we get to a bunch of foods that have a relatively high acid rating. Other than foods, certain conditions such as diabetes result in low pH in the urine. There's some genetic conditions where your kidneys simply cannot produce enough citrate. So in these cases, we prescribe what we call alkalinization treatment, which is basically citrate. We supplement your body with extra citrate, and that should raise the pH or reduce the acidity of the urine. Obviously, diet, try to cut back on the acidic foods. Allopurinol is a medication we prescribe occasionally in patients where the uric acid level is just too high. So allopurinol is a medication that shunts some of the pathways of protein metabolism. So the end result is less uric acid in the blood and eventually in the urine. So these two tables list a bunch of foods and their acid load potential. So on the left, these are the beneficial foods, so you can see a lot of fruits, vegetables, some beverages. And on the right, these are the not so great foods. There's a lot of good things here too, but it's just that they have an acid load. So you have to note that this refers to 2.5 ounces of portion. So you can drink 2.5 ounces of tea. I can't imagine drinking 3.5 ounces of Parmesan cheese in one go. Really, the point is not to focus on each food item. You really want to see that, look at it as In general, the fruits and vegetables are beneficial. Also, beverages, they have a negative acid load. And the things that are loaded with protein, such as meat, grains, cheese, they have a relatively high acid load. Again, it doesn't mean that you need to cut back on eat cheese. Just make sure you balance the two. Increase your fruits and vegetables. The recommendations about 5 items a day. Also increase your food, and that should balance everything. Just another slide about the acid load. Again, fruits, vegetables, oranges and lemonade have a lot of citric. That they will help find that acidity, that acid load. There's some supplement, over-the-counter supplement, just crystallized. These are powder sticks which you dissolve in the water. There's a bunch of citrate supplements. They're all pretty legit. We also prescribe potassium citrate in form of tablets or fluid. Some patients find it difficult to tolerate potassium citrate. Another alternative is sodium bicarbonate. This is actually
straight out that door.
medication. So, if you don't want to take citric supplements, you can simply take half a teaspoon of baking soda. That's a pretty good load of alcohol content. We usually prescribe anywhere between 30 to 60 milliliter equivalents per day. So 1 tablespoon of baking soda is a pretty good load. Yeah.
Does drinking alkaline water have any benefit compared to using water?
Oh, that's an excellent question. I actually asked a kidney stone dietitian this question, and she thinks that it doesn't have any effect. And the reason is what they do is they just extract the hydrogen ions from the electrolytes. So it's simply artificially manipulate the pH just by reducing the hydrogen ions. So there's no addition of alcohol or glycol, things that actually reduce the acid load in the urine. So going back to the 24-hour urine collection, we look at what kind of urine collection. So most important is the urine collection. So this is the actual patient. Usually, we typically order two collections to start with. So these 2 collections, the urine production is not great, less than a liter. And the calcium is quite elevated. And the citrate was pretty low. So if you take all these numbers into account and high sodium in one day, you end up with a pretty elevated supersaturation of calcium oxide. So I guess this patient was advised to increase their fluid intake. Now the urine volume is still not great, but it's over 2 liters, which is a good start. But it was probably started in a citrate supplement. So the citrate went up from 280 to 20 to 550, which is a better number. And possibly they would also start on a thiazide right away. So the calcium went down from 250s to 160, which is a normal range. So again, you can see that the supersaturation, which is actually essentially the risk of forming another stone, went down from 11 and 13 to 4, which is a good range for someone with kidney stone. So again, just a brief summary of the dietary recommendations. Food intake way more important than anything else. So over 2.5 liters a day, so over 85 ounces of fluids per day, pretty young fluids. Cut back on salt, less than 2 grams or so. Oxalate consumption, you don't necessarily have to cut back on all these healthy foods. Just be aware of oxalate in certain foods. Calcium should not be avoided. Don't try to cut back on dairy products or calcium supplements. This is really not enough. You know, simple carbohydrates are not great, but they result in a lot of calcium. And protein intake should be also moderate. This is kind of hard to calculate, but we generally recommend not more than one portion of protein per day, and portions about the size of the palm. So again, going back to this myth we discussed in the beginning, you know, this is all my stones? Probably not. The only stone that we can dissolve is uric acid state. That is typically done by a high load of citrates. You know, water intake, all I need to do is to increase my water intake, maybe. But, you know, just going back to that urine collection. You know, this is the bottom line, right? The supersaturation. If you increase the fluid intake, but the calcium remains elevated and the citrate remains low, you know, this would not change much. So fluid intake is not the only thing. Cut back on dairy products. Yeah, not a good idea. Don't cut back on calcium, you know, you result. It would probably not prevent an skin stone, but it would also result in loss of bone mass. Start drinking coffee. That's perfectly fine. Coffee is perfectly fine, probably better than wine. At least for the purpose of skin stone prevention. It's you know, has a negative acidic load, and it also acts as a diuretic. So it actually produces more urine, so it produces more diarrhea. Eliminating red meat from the diet, again, acidic load is important, but it's not the only thing. So there's a lot of factors that, you know, that we have to take into account when we try to do these things. And that would conclude. So thank you for your attention, and have to take any questions.
We have two questions. The first is, does cranberry juice help with kidney stones?
Yeah, we get this question a lot. Cranberry juice is more importantly in urinary tract infection prevention. There's some molecules in the cranberry extract that prevents some of the bacterial attachment to the bladder, that will prevent infections. Not sure if they contribute anything to kidney stones prevention.
Would it be better to get calcium through a supplement or through food?
That's a good question. You know, there's a, it's listed here, the recommended amount of calcium per day. Yeah, it's about 1,000 to 1,200 milligrams per day. You know, in general, if you take the standard dose of the supplement, calcium supplement, vitamin D supplement, you should be fine. You know, as long as you're not overdoing it, your kidneys will find a way to get rid of all the extra calcium.
Another question we have is, what are good sugar substitutes for diabetic patients who also have kidney stones?
Oh, that's a good question. I'm not a diabetes specialist, but you know, in general, the problem in diabetes is that the urine is just too acidic, and it's not because of the load of protein. It's just the way that there's insulin resistance. The kidneys having a hard time to neutralize all the extra acid. So really the treatment in that case would be better diabetes control, or if the pH, the urine pH is really acidic, so you just add a citrate supplement to increase the pH and prevent stones. As far as supplements, I guess there's some kind of stevia, or supplements that instead of sugar. There's something that I probably want to discuss with the primary doctor diabetes specialist.
For a man with prostate cancer, what about dairy in your diet? Should it be eliminated? What's your recommendation for patients?
Yeah, I know there's some data here. Maybe Dr. Joseph can help. The effect on dairy products and prostate cancer. There's some hormonal link between, I guess there was some evidence suggesting effect on the hormonal system with dairy products and prostate cancer.
Yeah, you just caught me off guard. I was sending a text out. As we may have shared in the past, diets that are rich in animal fats are certainly more problematic with prostate cancer. In countries that are where low animal fat is concerned, we see lower incidence of prostate cancer. Where there is higher fish consumption, for example, much lower rate of prostate cancer. This is like Japan, much lower than our rates of prostate cancer here. So, correlate of it, sorry, animal protein, animal fat, animal milk, what have you, is certainly higher risk as such.
Thank you.
Yeah, we actually get a lot of, we see a lot of patients who already have some degree of urinary dysfunction, prostate enlargement, things like that. And that prevents them from increasing fluid intake. We are urologists, we can take care of your prostate too. That's a barrier to increasing your fluid intake bladder, overactive bladder, urinary leakage. We can take care of that too, so you can increase your fluid intake.
My question is sort of semi-related to that as well. Real treatment for prostate cancer, like radiation or surgery or hormone therapy, increase the risk of developing kidney stones or kidney infections or any of that?
So not necessarily, because again, it wouldn't affect the composition of the urine. And we do see some complications after prostate cancer treatment that result in obstruction of the urinary tract. And that may promote kidney stone formation. This is very occasional. It's not overall there's no increased risk of stone just because some have treatment of prostate cancer.
Do certain medications play a role in developing these things?
Yes, certain medications may cause some changes in the urine, whether it's acidity or other some components in the urine. One of them is Topamax, for example. Used for some migraine, seizure, anti-seizure medication. So there's Topamax, there's some other uncommon diuretics for glaucoma. These can manipulate the pH of the urine a little bit and promote stones. They actually raise the pH so that the urine becomes less acidic, like abnormally less acidic, and that could promote calcium phosphate stones. So these are the diuretics. There's also the first days of HIV treatments, there was some medication that would precipitate in the urine and cause kidney stones. We usually actually medication crystals that attacks the urine. Occasionally in kids we see in babies born with heart failure and treated with diuretics. We see some precipitation of these diuretics in kidneys. Yeah, but overall, it's not a very common thing to see kidney stones because of conditions. I mean, we do see them with supplements. If you take abnormally high levels of supplements, vitamin C, D, that is definitely a risk factor for stones.
have a couple of questions. Could you expand on how gut bacteria prohibits oxalate binding? And
Right.
and the second part of that is the binding of calcium and oxalate, is it triggered by phosphorus or
No,
accelerated?
no, so in the gut, again, there's a bunch of healthy bacteria in the gut, right? And,
Unless you take antibiotics.
right. And so antibiotics doesn't kill all your gut bacteria. Right? It certainly results in some. So again, our bodies cannot break down the oxalate. So once the oxalate gets absorbed from the gut into the bloodstream, it'll find its way to the urine. In the gut, however, there's some colonies of bacteria that have an enzyme that allows it to break down the oxalate. So that could take some of that oxalate. So occasionally we see patients who are been treated for long periods of time with antibiotics because of some chronic infections. And they can form calcium oxalate storm because of increased available oxalate in the gut. The other issue with calcium oxalate, so when you take you eat a meal that has a lot of oxalate, the oxalate will find its way to get absorbed. However, if you're taking enough calcium, the calcium ion will bind the oxalate. It's basic chemistry. The oxalate is calcium is a +2 and the oxalate is -2, so they just bind each other for a complex. And that complex stays in the gut, doesn't get absorbed.
I'm sorry, one more time on that.
So the calcium and the oxalate, once they're in the gut, so if you eat let's say spinach salad, has a lot of oxalate, right? But you supplement it with a glass of milk that has enough calcium. So the calcium ions and the oxalate ions will bind each other. And this complex will not get absorbed into the bloodstream. But once it's bound in the gut, it'll stay in the gut and that's it. It'll never reach the kidneys. So that's why it's important to supplement calcium, especially if you're taking a lot of oxalate in the gut. And that's different than what happens in the kidney. The calcium and the oxalate bind each other in the kidney, in the urine. They will form a crystal, which later can develop into a spot.
As somebody who's had oxalate, uric acid stones, calcium stones, and uric acid stones,
Yeah.
what do you do with a diet? Because it seems to contrast. And what I've done is just increase my fluids, get rid of any nitrates, a pineapple or two a week, and no stones passing anyway for 4 or 5 years.
Yeah, so the probably doing it again. And
It is a balancing act.
yeah, if you have uric acid stones, I assume your urine is somewhat acidic, so citrate supplementation.
I used to have high uric acid, but I've gotten that down by getting rid of a lot of junk meat.
Yeah, simply by adjusting your diet, if you reduce the load of uric acid, that would be beneficial. Less acid load, less uric acid.
What I'm concerned with is the binding of the calcium and phosphorus it's recently been discovered that that's what causes the calcification in arteries and particularly heart valves.
Right.
You know that?
Yeah, I know there's some, they're trying to cut back and supplement calcium nowadays. Because
It's in its crazy.
it can result in some vascular calcifications. Yeah, I think the plaques in the arteries are a little different. The calcified plaques are a little different. They form because there's an injury to the lining of the blood vessels. So it's not because of high concentration of calcium, just because there's an injury to the lining of the blood vessels and then there's a calcium deposit.
So in other words, it's almost an immune system T-cell type of response that triggers the strengthening of those muscles. Anyway,
I I'm not sure. Not sure if it's immune mediated, but, certainly, cholesterol fats contribute to these processes.
So what's the best diet for somebody that has had these combination stones?
So again, there's some general dietary recommendations, right, for putting some formats. Less acid load, increase your hydration, less salt, increase your fruits and vegetables, into lemon juice, lemonade, orange juice. So all these things will eventually result in less supersaturation of calcium ions. But probably in your case, if I had to guess, it would probably be low pH, so acidic urine. So just increase the fruits and vegetables, less red meat. Things that will eventually increase the acid rate.
What is the more balanced combination you're referring to?
Yeah, balance too.
So perfect example would be like a salmon salad with citrus, with berries.
Yeah,
You got your proteins, you got your
exactly.
you've got your calcium in the salmon, you've got your oxalates in the spinach or mixed green salad, and then you've got your citrus in the
Exactly. And add extra plus of water too.
You can't have the chili and white bread dipped in the oil simultaneously.
That's good. I like that too, but so,
Thanks.
we'll have to balance everything out.
Apple cider vinegar, did you talk about?
Yeah, I believe that adds some, I've heard that too. I believe there's some benefit. It ultimately results in higher levels of citric in the urine. Maybe it will not break down the stones, but it might add some of that buffers to the
The
urine.
citrus is the alkalinization of the blood in the urine. Which would be like pineapple and
Yeah.
higher fluid intake. So yes, one more thing, boy, by all means, the popular dark beers, the sediments,
I'm not sure about the dark beers, but certainly the dark sodas. They have phosphoric.
also is, yeah, especially diet.
We've seen patients who drink this.
And dark alcohol.
They have that. What do they have?
Oh, the 6-pack of Pepsi a day.
Yeah, but we so they have stuff that he's, what do they have in them? The dark.
Oh, phosphoric acid, yeah.
Phosphoric acid, yes. And then the phosphoric acid combined with calcium.
So it's not a phosphate ion, it's just phosphoric acid, it's a different molecule. But eventually, this is a relatively high load of acid. And that consumes that citric. So you end up with less stone levels in the urine.
What do you think of over-the-counter remedies like kidney pop? People are doing?
I'm not sure. We get these all kind of patients showing us all kind of products they sell online. But these things are not regulated. So maybe some of these products are beneficial molecules or substances, such as citric, for example. But we see a lot of weird stuff. There's a couple of times a supplement that helps prevent kidney stones and gallstones. This doesn't make any sense. Gallstones are cholesterol stones, kidney stones are calcium-based crystals. I would try to stay away of this weird supplement, or maybe ask your urologist. All right, thank you so much.